Masks will no longer be mandatory on public transport in Western Australia, under new rules announced by Premier Mark McGowan. From next Friday, September 9th, people will no longer be required to wear masks on public transport, in rideshare vehicles, and on interstate and intrastate flights. Masks are still encouraged to be worn in crowded indoor settings where people are unable to physically distance, McGowan said in a statement. Live updates: migration cap to be lifted to protect the community. Western Australians are reminded to practice healthy hygiene, stay home if they're unwell, test and isolate early and be cautious, especially when they visit high-risk settings. Dr. Paul Griffin, the Director of Infectious Diseases at Brisbane's Mater Hospital, said he was disappointed more people aren't wearing masks voluntarily in public. "We've seen this in a number of Asian countries for a long time," Griffin said. "But here, when masks are voluntary, they aren't really worn to high degrees." He said it hard to tell how effective a mask mandate on public transport is. "The risks are a little challenging to quantify," Griffin told 9com.au. "There's high volumes of people in a confined space, but people are often on for short periods of time." He said it would be better if COVID-19 rules were consistent nationwide. At present, mask mandates are in place on public transport in New South Wales, Victoria, Queensland, the ACT and South Australia. People are not required to wear masks on public transport in Tasmania or the Northern Territory. Read more: Retail that's ripping off Aussie shoppers. Other WA rule changes: visitation limits will be eased for residential aged and disability care facilities. Starting from today, the facilities themselves will be able to determine how many visitors each resident can have in a day. Proof of vaccination will still be required for aged care facilities. Visitors at hospitals, correctional facilities and aged and disability care facilities will still be required to wear a mask. Explained: what are your chances of getting COVID-19 more than once? In line with the Prime Minister's announcement earlier this week, the COVID-19 isolation period in WA has been reduced from 7 days to 5 days for asymptomatic people. Staff, elective patients and visitors at hospitals and aged and disability care facilities will still need to wait 7 days to enter, even if asymptomatic. This also applies for close contacts of confirmed cases. Read more: deadline looms for NSW Rail Union to call off strike action.